Summit this morning. We have some exciting things to talk about. We've got a great group of presenters that will be telling you all about child welfare and as it specifically relates to what's going on in the 87th legislative session and Comal County. And we could not do this without the partnership with and the leadership of TexProtects. We are all really honored to work together for the kids and the families that we all collectively serve in our area and across the state. I will take just a couple minutes. If you don't know about SJRC and our new division Belong, I want to just let you know who we are and then kind of go into the rest of the presentation. But we, SJRC Texas, has been taking care of kids in the foster care system for nearly 40 years. We have residential facilities, we have foster homes in the communities, we have an entire prevention department working to ultimately prevent kids from becoming in the system at all. That's really our main goal as an organization, is prevention and permanency. But if their stop along the way is residential foster care or child placing agency, we ensure that they have the best and safest place possible as they're on their journey. And then officially, as of yesterday, we went live as the community-based care lead agency, or the SSCC, single source continuum contractor, for 27 counties in Region 8B, and that is our new division Belong. So we launched Belong live yesterday, and we are starting day 2 today. We've been for 6 months doing our readiness to get ready for stage 1, and we are officially in stage 1. And I think later on this morning I'm going to talk a little bit more about community-based care. But if you see SJRC Texas and Belong, that is why. So an exciting time for our community, for our organization, and all of our partners. So again, thank you for joining us this morning. And I know that you are going to learn a lot from this esteemed panel of professionals that are all good friends and great partners in working together for our children. So with that, I will turn it over to Sophie.
Thank you, Tara, and thanks everyone for being here this morning. I'll just take a minute. I just wanted to introduce myself. I'm Sophie Phillips. I'm CEO of TexProtects, and grateful for everybody's partnership, and grateful for everybody this morning. I'm just here to introduce and say a thanks to our sponsors, the Texas Child Welfare Funders Collaborative, as well as Casey Family Programs. And Christine Gingen is here representing the Texas Child Welfare Funders Collaborative as a vice president of KPG Family Foundation, which is a small family foundation that offers grants to organizations providing direct services for children and families. And she also is a vice president for program development for TFI Family Services, which is a multi-state child welfare organization. And she's also a foster parent. I know many of you know Christine, and good to see you. She's worked in child welfare for 15 years and is previously the executive director of the Texas Network of Youth Services, or TNOYS, for 8 years. So thank you, Christine, for being here and being willing to share a little bit about the Funders Collaborative.
Thank you, Sophie, for the introduction. And I want to thank you and the rest of TexProtects for offering this Texas tour. So the updates that you guys have for us today about what happened during the recent legislative sessions, plural, and about the biggest and most pressing issues in child welfare are issues that are important to Texas Child Welfare Funders. And so we are proud and pleased to sponsor this tour. As you can see from the slide here, so our purpose is to optimize the child welfare system to achieve the best possible outcomes for kids. We are a nonpartisan educational peer group for funders. We are under the administrative umbrella of Philanthropy Southwest, or PSW. But if you're a funder and you want to participate, you don't necessarily have to be a member of Philanthropy Southwest. We encourage it, but we want to get we want broad participation in this group. So it's open to all funders. There are not any dues. And if you're interested in learning more, there's information on the slide about how you can do that, or you can reach out to me, and I would love to help get you plugged in. But thank you, TexProtects, for all that you do for kids and families in Texas and for offering this tour. I will pass it off to Carrie so that she can get started.
Thanks so much, Christine. And thank you all for joining us here this morning. I've seen the numbers on the participant list kind of slowly but surely going up. So thank y'all for taking some time out of your morning, out of your day to join us for this really important conversation. I hope you guys enjoy it. I know we're looking forward to learning a lot from you guys and what's going on in your community. And so for those of you who don't know me, my name is Carrie Judice, and I'm the CPS Research and Policy Analyst at TexProtects. We also have Brittany Taylor here, which you're going to hear from today. She is our Prevention Research and Policy Analyst. So as Christine kind of laid out as well, we're going to be walking through what happened this past legislative session as it relates to child protection. And then we're going to talk about where to go and what to focus on from here. For a little bit of housekeeping, feel free to use the chat function and share your thoughts with us. We will be saving the chat just to make sure we collect all of the great input you guys have for us today, and also to know who's joining. Please stay muted just so we can make sure that everyone can hear without any distractions. And lastly, we will be sending out this presentation and a recording in the follow-up email to all who registered for the event. So even if you're talking with some of your close colleagues who weren't able to jump on this morning, if they registered, they will get those links. So again, today we're gonna we're going to share with you information regarding the session, or as Christine reminded us, sessions plural, but the majority of our time will be spent hearing from you and hearing from our expert panel. You all are experts on this call. We want your feedback on the session and also your very important input as we move forward, including how we can continue to stay in partnership and collaborate with you all. And so I do want to just say really quickly, this is in no way TexProtects coming up with solutions or saying that we have the answers, but rather this is about us building that partnership with you all to advance policy to improve the lives of children now and into the future. So for those of you, I think many of you on this call are familiar with us. We've likely worked together, but for those of you who don't, I do want to just kind of give a brief introduction of who TexProtects is. So we're the only nonprofit, nonpartisan advocacy organization in Texas that is singularly focused on the prevention of child abuse and neglect. And we focus our advocacy efforts really all along the prevention spectrum, as you can kind of see the different areas in our scope here. But going into session, I want to kind of give that 10,000 foot view here. So as you remember, going into the last legislative session, we were smack dab in the middle of a pandemic where we knew families were experiencing increased stressors. They were more isolated than ever in dealing with unemployment. We were seeing an increase in the severity of child abuse cases, as well as increasing social, emotional, and mental health issues for kids and family members. We were going into session really with a sense of urgency to help families. But at the same time, we were also dealing with a very different environment. So with the health risks associated with COVID, the typical work that's done in the interim between lawmakers to reach some sort of consensus on priorities or really vet ideas was pretty much non-existent. We had to get creative with how to meet with lawmakers and their staff virtually when people were already zoomed out. But nevertheless, we really advocated tirelessly for kids. And we're here to share the wins, the missed opportunities, and figure out how we can move the needle in a positive direction for kids and families together with you all. I do want to take another moment to pause and say again, thank you for all of you joining this call. It's super important. And what you guys do every day is so pivotal and so important. And please know that we see you and we know you're making a difference. I know in this work, sometimes it can feel like you take a step forward, but 2 steps back, or it's hard to kind of see the wins sometimes, but we see you guys, we know you guys are working tirelessly, and thank you all for that. And we know that there's going to be tons of opportunities in the future as we move forward together. So another thing, just again, before we kind of dive into more of the details, I do want to start out with some context as to what was going on with the child protection system when we entered session. So we were facing a system already in crisis, and there's a lot of pressure to change. There's an ongoing federal lawsuit that has been going on now for a decade that is still showing that the state is placing kids at an unreasonable risk of harm, sometimes leading to more trauma in CPS care. The state has also been moving away from a one-size-fits-all state approach to shifting the responsibility of foster care services to communities, community-based care, or CBC, which I know you guys are right smack dab in the middle of. And of course, you all may have heard in the news There's been a foster care placement shortage, leaving hundreds of kids without placement, meaning they're receiving 24-hour supervision by CPS staff in temporary settings. And those staff are, they're exhausted, and there's a lot of responsibilities put on them. We even entered session with an opportunity to get matching dollars on funds that could prevent removals and keep families together. So I think many of you are familiar, the Family First Prevention Services Act, or FFPSA for short, changes how as a state we can use federal dollars on efforts to actually keep kids out of care and to truly think more upstream, which I know we have a lot of like-minded folks on this call today that really want to see that happen. And so with all of this, the time really seemed ripe. It really seemed like it was an obvious time to come up with solutions that could drive a transformational system. So I do want to take just a couple of seconds here to focus on a couple of terms, just because you're going to hear us talk about them today. And y'all already heard me talk about, along the prevention spectrum. And I just want to take a second to talk about what we mean when we say that, because we will be talking about what our priorities were and what some of the things that came out of session were. So 3 components: primary, secondary, tertiary. So primary prevention strategies, those are those efforts that try to reach a family before abuse or neglect occurs. So you're going to hear Brittany and I kind of use terminology about that's strategies that reach families before a crisis. Then you've got secondary prevention strategies, and those are efforts to prevent maltreatment among families who are at high risk. And one way to think about that is these are likely supports to help prevent a removal for families who are already on CPS's radar. And then you've got the tertiary prevention strategies, and those are efforts to mitigate the effects, the negative effects of abuse or neglect, and to prevent recurrence. So another way to think of these strategies are that they focus on helping families who already have kids in CPS custody, and it's strategies to keep kids in care safe. So, did lawmakers rise to the occasion to shift the paradigm and truly transform this system? We answered that a little bit more fully in our end of session report, which when you get the slides, this is something you can click on and you can learn about that a little bit more in depth. But today we're going to kind of touch on some highlights that are in there. And the short answer to that question is no. But here's an overview of what did happen during session. So, 1, lawmakers showed that they have more faith in communities leading foster care efforts than in the current system run by the state. You guys know we've been moving towards a system where responsibilities for foster care services fall on community contractors with CVC. And I'm sure, as many of you are aware, there have been issues popping up in different areas, but still lawmakers felt like communities are doing a better job than the current system and decided to invest even more in CVC. They made it clear through legislation that they want better oversight of the CVC rollout and want the implementation to no longer be in the hands of the department, because they want to see it be successful. And like us, lawmakers were clear that they want the system to be efficient, effective, and safe for kids in care. And they want to ensure compliance with the lawsuit, which means ensuring kids in care are safe. And they want to keep families together and prevent removals. But I want y'all to hear that they had a different intervention point for how to do that. They focused on efforts to implement after a crisis occurred and once families are already involved with CPS. So let's get a little bit more detail here. This is likely something y'all are used to looking at over here. But so again, lawmakers, they have more faith in CVC. And I know that many of you in the room know this all too well, but for those, if we have a few of you who are not as familiar with CVC, so remember, this is where the state plans to contract with local providers like SJRC belong, they will be the ones to carry out foster care services. And CVC actually splits up the state into 17 different areas. And so for reference, CVC has been implemented in 5 of those areas across the state, which you can see in blue. In some areas like Fort Worth and 3W, Abilene and Region 2 have already taken over case management. So they're a little bit further along in that process. In one of those areas in the neighboring county, you guys know in Bexar County, they're re-procuring the contract there after Family Tapestry terminated its contract. So, it's interesting when you kind of think about the timeline for CBC. This was just formalized in 2017, so not all that long ago, and it's been in motion ever since. So despite those issues that we were seeing kind of pop up, again, lawmakers have more faith in communities. So they invested $79 million above the base budget to expand CBC into 4 new areas. And one of those, and part of that is, they wanted to bring, for you guys specifically, they wanted to bring the rest of the Region 8 into the fold, which includes your area. So obviously Belong has been named as that SSCC, and you guys have, I love the timing of this Texas tour, just getting started yesterday after a 6-month period of startup. So, and just for a little bit of reference as well, how they chose these areas, basically they took DFPS's lead and they were choosing areas adjacent to regions that were already implemented. And then they will also be moving case management into 3 new areas. And so the new areas are highlighted in green on your screen. Another thing about CBC, lawmakers provided an additional $34 million to build out capacity in CBC regions. So I'm emphasizing that a little bit because during the regular session, those dollars for capacity, despite the fact that there has been a capacity issue statewide, was just for CBC regions. And so it took 2 special sessions before they finally passed a measure that would allow for more appropriations for the rest of the state. And you guys are probably very familiar, have heard about the $90 million that was passed, and it will ultimately provide additional funding for foster care providers to care for kids with higher needs. And it'll also provide grants for plans to build out capacity longer term. We're still waiting to learn a little bit more of the specifics on that, but we are keeping our eye on it. So what else did lawmakers focus on when it comes to kids in care? You heard me say they wanted to see the system be efficient, effective, and safe for kids in care. And one way to do that is they spent a lot of money to come into compliance with the federal foster care lawsuit. They also passed measures that were aimed to improve the child protection system and promote higher quality placements for kids in custody. They also passed some measures that will address the placement capacity crisis and will ultimately allow there to be separation and oversight of CBC that you heard me talk about earlier. There also were some really big wins for older youth and young adults in CPS care. We work closely with a lot of our partners to ensure foster youth have all their necessary documents, improve transition planning into adulthood, and to remove barriers that prevent youth from staying in extended foster care. Also, there was, in part of this bill that had passed, it targets services for older youth to count toward college credit. So basically those PAL classes can now, count for college credit, and they want to ensure that basically kids can lock in their tuition and fee waiver, which is a really great win. Some other things for older youth, ensuring each child has representation in court for the duration of their time in care, that former foster youth don't lose healthcare coverage, and that youth in care are actually participating in normalcy activities. And one that I know that a lot of advocates have worked on for years is to make driver's ed more accessible. So again, really great wins for older youth. Some other priorities specific to kids in care. So you heard me talk about older youth. But you'll see on here one of our other priorities this session was around data. With all of the pressures that we had on the system that I talked about earlier, another one of our priorities was to increase the transparency, accountability, and effectiveness of CPS with the use of data. So one of the challenges that really became increasingly evident during the pandemic was the lack of aggregated real-time data made available to providers and communities. And so we strongly believe that accurate data can drive decisions. But data in the child protection system has typically lagged, with most of the information being updated yearly. So we worked towards codifying the child abuse metrics that CPS said they would start publishing. And while it didn't pass in a bill form, we did see a measure that was adopted into the budget to ensure critical child protection data is in fact updated monthly. Now moving into those secondary strategies. So let's take some time to talk about, that's where the focus is on families where there's risk of abuse and neglect. And in some cases, CPS is already involved in trying to help them with the goal of preventing that removal. And so one of our priorities this session was to take advantage of that new funding through FFPSA in order to keep families together. So I'm sure all of y'all are pros on FFPSA by now, but I will just take a second to make sure that we kind of have a refresher. So remember, federal dollars could only at one point could only be used on kids in care, but now they can be used to prevent kids from coming into care in the first place. So those dollars can be used to address what we know are the drivers of child abuse and neglect by making available a federal match for trauma-informed, evidence-based substance use and mental health services, as well as in-home parenting support to those who are at imminent risk of entering foster care. So going into session, lawmakers knew that Texas was going to be implementing FFPSA in October, so they needed to make some decisions. So going into session, Texas actually already had $50 million in hand of Family First Transition Act dollars. And those dollars were really earmarked to be spent to address like FFPSA startup challenges. So what we did, we advocated for basically the majority of those dollars to be spent to build upon the prevention infrastructure that's already in place at the department. And ultimately, we were glad to see that a budget directive was adopted and as written would allow for several strategies to be pursued. So we don't know exactly what specific FFPSA approved services will be used with those transition dollars yet, but we do know that there will at least be 2 pilots that are created with the intention of serving those families who are at imminent risk of having their children removed. And we know that family-based safety services, services that are meant for family preservation provided by CPS will now be FFPSA approved. And so we need to make sure that, that's important because we need to make sure that the services that families are receiving are in fact effective. So another thing I want to focus on here, because I'm sure a lot of you have heard about some of these bills specifically, because they were pretty pivotal on how they'll impact the system. So lawmakers really expressed concern that CPS is overstepping and funneling more families into the CPS system. So lawmakers tried to remedy this by proposing measures that would allow CPS to only focus on families at highest risk. That was the goal. And so one major change that came out of this session is a change to the neglect definition. So now, basically it includes, it takes into account a person's mental state and says there must be an immediate danger versus a substantial risk to the child. So I'm sure you guys can kind of hear the change in that emphasis there. Alongside this, non-emergency removals can no longer happen. Again, ultimately designed to make sure the system is only used for families at highest risk, which is a good goal, but it is possible that these specific changes could leave kids in unsafe situations depending on how those changes are interpreted and implemented. Another change that I want to focus on really quickly is the reporting of abuse and neglect. So now someone making a report to the hotline must have reasonable cause to believe that abuse or neglect has occurred. That's not new language for CPS or for us to kind of hear that reasonable language, but there has been concern that that addition of the one word into statute could make people question whether or not to call in a report in the first place. So we're going to be keeping an eye on that to see what that does as far as reporting. But now I'm going to pass it over to Brittany, and she's going to talk more upstream strategies for families.
Thank you, Carrie. So now we're going to talk about efforts that would reach families hopefully before a crisis occurs. So this past legislative session, TexProtects advocated to protect existing state funding and also increase investments in community-based child abuse prevention programs that we know are effective for kids prenatal up to age 5. So this is important because this age range is really when development matters most, and we also see the highest return on investment. So a few examples of these programs that we advocated for are the HOPES Initiative, Texas Home Visiting, and Nurse Family Partnership. These prevention programs that are funded through the Prevention and Early Intervention Division of DFPS are proven to keep kids safe, and they have also demonstrated a 2-generational positive impact on child and maternal health, school readiness, and family economic self-sufficiency. Like I said, we see great return on investments with these programs because they connect families with supports that exist in their communities before CPS is ever involved. Collectively, these programs serve more than 19,000 families in Texas annually. So ultimately, I am happy to say that prevention funding was maintained in the budget for this next biennium, but it was not significantly expanded like we would have liked to see. TexProtects also advocated for families to be reached and connected to resources at their most crucial and vulnerable time. And one of the ways is through universal home visiting. Specifically, the Family Connects program, which is a universal nurse home visitation program for infant caregivers. And this program has effectively reduced pediatric ER visits by 33% and CPS investigations by 39% through the first 5 years of a child's life. There are about 6 counties in Texas currently operating Family Connects programs, and Family Connects is expanding in the state as we speak. And collectively, this program served about 1,800 families in Texas in 2020. So TexProtects is, we advocated to establish a competitive grants process that would expand programs like Family Connects this past legislative session. And while this didn't pass in bill form, we were successful in getting a budget directive adopted. So this budget directive will ensure that the Health and Human Services Commission evaluates and reports on the total expenditures of CHIP funding and any unexpended or carryover funds. So gathering this information is going to be a really important first step to understand how much funding is available so that we can hopefully establish what's called a CHIP Health Services Initiative, or you might hear it referred to as a CHIP HSI, all the acronyms I know. But HSIs are any programs that could impact maternal and child health outcomes, such as expanding universal nurse home visiting programs like Family Connects in the future. So this is definitely something that we'll be following up with HHSC on in the interim to see how we might be able to leverage this for additional funding to expand programs like this one. We also entered this session wanting to ensure that every child can start with a strong foundation. And part of the way that we know we can do this is to prevent and mitigate the effects of adverse childhood experiences, or ACEs. I know most of you on this call are probably familiar with ACEs, but as a reminder, ACEs are traumatic events such as child abuse and neglect, living with a parent or caregiver who's experiencing substance abuse or incarceration. We know that evidence-based prevention strategies can reduce the prevalence and the impact of ACEs. In 2020, child abuse and neglect alone cost Texas an estimated $1.75 billion in CPS expenditures, and that does not even include the additional costs associated with the effects of ACEs. So unfortunately, Texas currently lacks a strategic, coordinated, and cross-agency approach to prevent and mitigate the effects of these ACEs on our children, meaning any state investments might be ineffective, inefficient, and really fail to address the root causes of ACEs. So TexProtects advocated for a community-based approach to improve the delivery of and the delivery of prevention and early intervention services in Texas, really focusing on empowering systems and communities to implement best practices and to identify existing services that are already in state agencies. Unfortunately, we weren't successful in getting this passed in bill form, but we had some really great conversations with lawmakers during session. It really, I think we did a good job of advocating for ACEs and also or preventing ACEs, but also just educating members on what are ACEs, why should we try to prevent them. So I think we did a good job of really setting the stage for the interim and hopefully next legislative session to continue to talk with lawmakers about this issue. We also had 2 other strategies that we worked closely with our partners on. One of which was to improve 211, or the Texas Resource and Referral Network, and make some really needed updates to that program. And another was to ensure funding for a program called MedCare, which is specifically for medical facilities who specialize in pediatric health to prevent, assess, and diagnose child abuse and neglect. Unfortunately, neither of these measures passed this past session, but again, we set the groundwork and we'll continue to follow up this interim and next legislative session. Okay, So what did lawmakers focus on when it comes to truly supporting families before a crisis occurs? So this past session, we saw the Early Childhood Caucus form in the House. And this caucus is focused specifically on evidence-based policies for kids ages 0 to 5 and their families. We're really excited about this caucus, and we're just excited to see how we'll be able to leverage this caucus, hopefully in the interim and this next coming session. There were also many great bills that were passed focusing on quality of childcare in Texas, and the Healthy Families, Healthy Texas initiative was supported by Speaker Phelan and a bipartisan group of lawmakers, which I know this past legislative session and special sessions, anytime we hear it was supported by a bipartisan group of lawmakers, I think that is a really big win. And this initiative was designed to increase healthcare access for Texans. So I just want to highlight two specific measures that were a part of this package. So specifically, Medicaid coverage for new moms was extended from 2 months to 6 months. You know, we were all advocating for 12 months, but 6 months is still a good place to start. And a second measure that was passed that will ensure that children are not unnecessarily kicked off of their Medicaid insurance through the CHIP program. And finally, like I mentioned before, the legislature did maintain funding for prevention programming through the Prevention and Early Intervention Division. So in the end, Texas did more of the status quo and continued to only spend a really small portion of its budget, about 5%, as you can see on this slide, on prevention, and the majority of its budget on more downstream efforts within CPS. So while lawmakers did some things to try and prevent removals, and they did pass some good measures, like Carrie mentioned, they really didn't do a lot in regards to supporting families further upstream before a crisis ever occurred. So we do feel that they missed the mark in this area and really missed an opportunity to transform the system as a whole. But that just means that we have a lot of work to do. So now that we've kind of laid the groundwork for what happened this past session, we're going to enter into a time of discussion where we're going to hear from an expert panel and also open it up to the audience so that we can hear from all of you. But before we pivot into that, we're going to take just a few brief minutes to kind of paint a picture of what is happening specifically in Comal County. So speaking of prevention services, we know that these prevention programs, such as home visiting, have positive outcomes for families and also a strong return on investment. But who really has access to these programs? You'll see on the map here, the shaded counties in Texas are the ones that have access to prevention and early intervention programs through DFPS. So in 2020, like I said, almost 20,000 Texas families were served by these programs. However, there are about 1.8 million families in Texas just with children under the age of 6. About 400,000 of these families may benefit from home visiting services. So that means really that less than 5% of families who could benefit from home visiting services are actually receiving them. And on this next slide here, you can see the breakdown of prevention and early intervention services offered in your region, in Region 8, and the number of families, again, served by these programs in 2020. So total families in the greater San Antonio Region 8 area served through PEI services in 2020 was about 2,700, and the majority received services through HOPE's funded prevention programs, Nurse Family Partnership, and Texas Home Visiting. I know a lot of you are probably already familiar, but just as a reminder, HOPE stands for Healthy Outcomes Through Prevention and Early Support. And this is a flexible community grant that funds a really wide variety of innovative initiatives and supports for children ages 0 to 5. These supports typically include home visiting services and other supports that help families build protective factors. However, in Comal County, the only PEI funded programs are STAR, which are services to at-risk youth, and the statewide youth services network. Both of these really target older children. And all of the data found on the slide can be found in the PEI data book. And on the next slide here, you'll see a Comal County home visiting profile that was put together for us by Child Trends. And you can see here that almost 6,500 families in Comal County have a child under the age of 6 and could possibly benefit from home visiting services. So we know that home visiting programs often target families who are likely to benefit from additional support. And these families may experience a variety of stressful situations that might put them at risk for poor outcomes. So you can see the chart here shows the number of families in Comal County experiencing these risk factors, and these could include living in poverty or overcrowded housing conditions, a parent who does not have at least a high school degree, or possibly a single mom or a teen mom. So families experiencing multiple risk factors might benefit from the extra support of these prevention services. So this slide is really just to give you an idea of the level of need in your community and the supportive services. So now I'm going to pass it back to Carrie, and she's just going to kind of paint a picture of what we know about children and families involved with CPS in your area.
All right, thanks, Brittany. So what you guys are seeing on your screen, it's the number of removals over the past 10 years, but more specifically, whether they happen out of an investigation or whether they happen out of family-based safety services or FBSS. So the majority of the removals have consistently come out of investigations, and that's really honestly consistent statewide. It looks like Comal County has stayed pretty consistent in the breakdown even of what you're seeing in investigations, which is that teal turquoise color, versus FBSS, which is that more maroon red color on your screen. And so, you know, with the change in neglect definition, you know, the repeal of non-emergency removals and the changes in concurrent stages that we know kind of came out of, you know, that's a DFPS move. I'm curious to hear, you know, whenever we kind of open up later, what y'all may know about what we can expect to see for 2021 numbers, if this is going to be kind of consistent, or if we're going to see some sort of shift in what this chart may look like next year. And then I do want to take just a little bit of time to hone in on see what demographics are for the kids in care in Comal County. And so there were in 2020, 288 kids in care. And so it looks like that tracks with state numbers as far as, you know, the breakdown, with the majority being, you know, kids age 0 to 5, kind of similar percentages here in comparison to the state. When it comes to placements, it looks like placement with relatives is a little less than statewide numbers. Please hear me when I say that I understand that kinship, you know, relative numbers, as far as what DFPS puts out there, you know, you really have to kind of understand the numbers because there's only certain measures that are tracked, and, you know, there's just more of a story than the numbers we're seeing on the screen. But it does look like y'all are placing less siblings together and placing more kids out of county. So I'm, you know, just going to be curious to kind of hear as we continue chatting about any sort of nuances in y'all's area. And then we would be missing an opportunity if we didn't talk a little bit more in depth about the lawsuit. Again, please don't frivolously be, you know, ferociously, you know, writing these things down. You will get some slides, but ultimately this is the timeline for the federal foster care lawsuit. And so right now we know that a big focus is on children without placement or CWAP. And so what you're kind of seeing on your screen that are in maroon are kind of some areas where we know we started seeing some shift in numbers. So, you know, heightened monitoring was instated in like last summer. And, you know, we know that the numbers of CWAPs have continued to grow, but there were also beds being lost. And then we saw in like February of this year, the governor basically said, hey, state agencies, you need to comply with this lawsuit. And we continued to see the number of CWAPs go up while the numbers of beds went down. And so, you know, I will be interested to see, again, whenever we break into the panel discussion and hear from the audience, you know, if there's any providers in the room that might be able to shed some light on what's going on in Comal County. And so, you know, again, we know that there's been, you know, lots of kids without placement. We don't know, because this isn't information that's publicly made available. We don't know how many kids of those are in Comal County, but I do know that y'all's area is impacted. We do know that there are kids with significant mental and behavioral health needs. That's kind of who makes up this population of CWAP. We also know that unfortunate circumstances sometimes happen, you know, while the children are in a CWAP situation. So, you know, we know that the department is working towards a plan. You know, that was something the judge had laid out in that last hearing. So again, just going to be interested to hear if any of y'all have some insight into what is going on specific to y'all's area. So let's see. now we are going to move into the time that I know this is why you guys all tuned in here today. We want to open it up to a discussion about what's going on in y'all's community. We want to hear from the experts. That's why we're here. We want to hear from you guys. And so we're going to hear from a panel of experts on some of the topics that are front and center in y'all's area. And we'll be asking questions to engage in a dialogue with both them and you all, because like you heard me say earlier, actually, you all in the audience, you guys are the experts as well. We want to make sure that we also know who is with us today. So before we jump in, before I have the panel talk and introduce themselves and kind of, shed some light again on what's going on in y'all's area, I will ask that everyone please utilize the chat. If you want to bring that up on your screen, please tell us who you are, who you're with, and if you are a provider, who you serve. I know that maybe not everybody here is a provider today, but some sort of indication to us, kind of who you work with in your interest today, so please utilize that chat. We will be saving the chat because, again, you heard me talk about partnerships earlier, and we want to be able to know how to reach you guys and know what level of expertise and what insight you can bring to the table. So what I would like to do while y'all are doing that in the chat, will the panel, kind of one by one, introduce yourselves. And I think the easiest way to do this is in the order that you see it on your screen. So if you guys want to do that, Tara, can you kick us off here?
Absolutely. I think I said some of this at the beginning, but maybe not. I'm Tara Reset. I'm CEO of SJRC Texas and Belong, and I have been working in the child welfare field for well over 20 years, and I've been at my agency for 13. And I will introduce Jackie.
Hi, everyone. I'm Jackie Gonzalez, and I'm the Chief Prevention Officer with SJRC Belong. And we offer prevention services and parenting support to all the 27 counties throughout Region 8B. We are unique and we are one of the first lead providers of CBC that is offering an entire department that's just dedicated to prevention. And we really want to be able to support families so that children can stay in their home if at all possible. I'll pass it on to Jenny.
Hey everyone, my name is Jenny Lord. I'm the CEO of Chosen, originally based here in New Braunfels, Comal County, and we serve all of Region 8B and throughout the state. Our mission is to help children heal from trauma by strengthening their families, and we provide an array of mental and behavioral health services as well as parent coaching. Our focus is really on equipping caregivers to be agents of healing for their children in their home so that placements don't break down. And we serve 4 populations. We serve foster families, we serve kinship relatives, adoptive families, as well as birth families who can be safely reunified. And I've been in this space professionally for almost 13 years and have been connected to child welfare for about 26 or 27. So I'm aging myself. I will pass it on to Trendy.
Hi, everybody. And I'll age myself too. It's 28 years, I think, including being at the DA's office. Goodness gracious, what a great morning and how to start out, right? So I've been at the Children's Advocacy Center, though, for about 16 years now. And what we do at the CAC is we provide forensic interviews and counseling and medical examinations and case coordination to a multidisciplinary team, which includes the DA's office, CPS, law enforcement. We also review statewide intakes daily. So once upon a time, those intakes just came into CPS and law enforcement, but now we also get the reports every day and review them. And then we coordinate the joint investigation between law enforcement and CPS. So that is what the CAC does. I see my slide up. Am I supposed to go into the 5 steps now, or am I supposed to wait and introduce Jacob?
That is totally up to you. If you wanna talk about that now, that's totally fine. I leave it to you guys for how you guys want to use your time. So.
Are you guys gonna say I hog the whole session if I just keep going and don't interrupt? Jacob's saying no. Go ahead. Go. All right, well, I'll just do my part really quick and then we can turn it over and you guys can say, thank God she stopped talking. But I've learned a lot about kind of where you guys are coming from, and I love the prevention approach that y'all have. I did want to add just a real practical thing that we do with our Darkness to Light program for preventing sexual abuse. And I know that most of the people on here that I've seen, you guys know this is definitely preaching to the choir, but anytime I get an opportunity, I throw these very specific practical things out for prevention. And that was my given like topic today, smart approaches to prevention. And I think the smartest things are the little things and the very practical things. So number one would be, of course, learn the facts, know how abuse works. It's not typically something that happens with strangers. It happens within the home, most usually, or someone that is really close to the family. Number two, that's the big one. If I have one sentence to say when I'm out in public to people on how to prevent sexual abuse, particularly, I say, have an open door policy. That's minimizing opportunity. Make sure that there is very little opportunity for one-on-one contact between adults and children, if you can. Number three, talk about it. Things thrive in secrecy that should not thrive. Not talking about body parts or sexuality in an appropriate way with children makes it so that perpetrators can come in and make it feel dirty and forbidden. Number four, recognize the signs. It's not obvious. I wish that it were. I wish that kids like had a big mark on their head or something when they've been abused, but that is not the case. Recognizing the signs can be subtle. It can be something like a complete turnaround in behavior. It can be behaviors that you're like, oh, it's a teenage thing, but it really is maybe a cry for help. And of course, number five, the most important one, react responsibly. If a child should come up to you and make an outcry of abuse, please stay calm. And I know that all of us want to scream and yell and start to try to hunt down the perpetrator. And all of that is normal, natural, but probably not helpful. So remaining calm and then telling the child that you believe them and that you support them and you're here for them. And then calling quickly to report child abuse. That would be a really important part of it. So that is, in case anyone doesn't know, which I think all of you guys probably have it memorized at this point, 1-800-252-5400. Now, that's it for me. I'm going to stop talking and turn it over to the great Jacob Harica from Connections.
Okay. Hey, Trendy, you could have introduced me. My name is Jacob Harica. I'm the CEO of Connections. We're well known in Comal County for our children's shelter, which also serves foster youth as well as runaway and homeless youth. So we serve as a safety net in that area. But the majority of our services that we provide in the community are PEI services. We have a family and youth success program that we run in 11 counties where we provide free counseling to youth and their families if needed. And then we also do substance abuse and prevention in 17 counties in schools where we try to talk to youth about self-esteem and self-resiliency so that they can make healthy choices. So in total, Connections will serve around 4,000 individuals a year. And I can't wait to talk because I do want to talk about foster care capacity and PEI because I feel like that is the trend. So with that, I'll turn it back to the panel and then I'll shut up until it's my time.
Y'all are too funny. I promise y'all are not talking too much. Everything you guys have to share, this is great. So real quick, before we kind of start with some questions based on what I know y'all's expertise is, I do want to just say this. So obviously we're already kind of utilizing the chat. Again, if you haven't introduced yourself in the chat, please do so. Again, we want to know who you are, who you're with, who you serve. If that's something, you know, you guys want to share in there, we just want to make sure we know and can capture who all's here today. But also, you know, like I said, you know, the experts are you guys, all of y'all on the call, the people on the panel, the people in the audience. So, you know, we have a limited time. Trust me, I wish I could come and spend a whole day with y'all and just hear everything. But I think maybe the easiest thing may be is as we kind of ask some questions, just again, because we have limited time, if you want to share something in the chat or you want to add something to something the panelists are saying, just in case we aren't able to get to everybody, please feel free to chat, to say something in the chat. Again, we will be saving that. And also Brittany and I are going to be taking notes just to make sure that we can always reference all the wonderful things y'all are sharing with us. So Brittany, do you want to, I know you've got some questions you're eager to ask. Do you want to start us off?
I do. Thank you, Carrie. And thank you so much to Jackie for putting on my radar that yes, SJRC recently received the HOPE grant through PEI at the end of September. So that is really exciting, and thank you for bringing that to my attention. And Jackie, I'm just going to pick on you again. I'm sorry, but I wanted to ask you our first question here. When it comes to prevention, what could other communities take away from what you are doing really well? And you can start us off, and then if anybody wants to chime in, that would be great.
Yeah, I think specifically for our prevention department with SJRC and Belong, we rely heavily on our partnerships, just like with families, but it takes a village to be able to function and to be able to be successful. It's the same with child welfare and with the nonprofits and the agencies and all of us together. We all have the same goal in common. So we just really partner with everybody in our community. We don't try to do it on our own. And I think that has really added to the success of not just our PAT program, but all of our prevention services. It's just the partnerships. I don't know if anybody else from the panel wants to add to that. That's what immediately came to my mind.
No, that's really great. Thank you for sharing that, Jackie. And I mean, I can tell just from the brief time that we've been on this call together that it seems like everyone in Comal County is very collaborative, which is amazing. And like you said, this is too big of an issue for just one organization to be taking on. So I'll pivot a little bit, and we're doing some prevention questions first, but don't worry, we're going to get to transforming the system and foster care capacity and other issues. But sticking, in the prevention world, and I'm just going to open this up to anyone on the panel. What are some hurdles that keep you and your organization from effectively serving children and families?
I'll start, and then I'll pass it on to, I think Jenny might be a really good one, and anybody else that wants to talk. But as we're transitioning from simply a provider to a community-based care provider, some of these hurdles will naturally alleviate themselves as we go into stage 2. But for years as just a provider, we have never had access to the families. And so you don't get to go into the families. You get the children after they're removed in the care, and you're providing the best possible care that you can. But without having full access to the families to have those services, it really makes it challenging. And that was one of the reasons why we brought our prevention program on. And when we did, and that was from a gracious gift from the McKenna Foundation, and we're so grateful for all of them for giving us this program and letting it flourish with us, because we recognized that we needed to have that piece. And so we can get to families hopefully now before they even get removed from their home. And then again, as we enter into stage 2 for case management and community-based care, and even starting now on day 2, we are really starting some of that work already to be able to get access to the families. And so I really think without full access and kind of getting the red tape out of the way and letting the folks that do the work, it's always going to be a hurdle. And then Jenny or Trendy or Jacob or Jackie, anybody else that wants to add.
Let me make sure I answer the right question. So was that particularly effectively serving the children and families before removal? Is that
either way, whichever way? Yep.
Yeah, I would say access to the families has been a challenge. Sometimes working with the department, there are barriers that prevent us from effectively working with families. I'll come back to that thought in a moment. But one of the things that I've seen in Bexar County that's different from Comal County is there's programming around early intervention that's tied to the court. There's also family court where there's some of those intervention or intersections for possible intervention to keep families together or help them be reunified. That is funded through some special programs through the court, and that's well established through Bexar County Children's Court and Family Court. And we don't have some of those same mechanisms in place here locally that give us access to those children and families sooner in the process. Going back to just what Tara was talking about. When we have the opportunity, particularly I'll talk from my agency's perspective, when we have the opportunity, when there's struggles with these families, as there are inevitably going to be. I have 4 biological children and we have struggles. Family is hard and messy, and we live in a really challenging world. And then when you look at this population that we're talking about and some of those risk factors, poverty, and just a number of things that are impacting their lives that make it even more difficult coming out of COVID, us seeing those mental and behavioral health numbers shoot up, even in our own practice, seeing suicide ideation and self-harm, like those numbers increasing as well. So every family has these challenges. And unfortunately, we have a very punitive system that sometimes makes it scary for families to raise their hand and say, I need help. They don't know where to get the help. They might be afraid to tell if they're a foster family, they might be afraid to tell their child placing agency that they're struggling with the children's behaviors in the home. And we have to remove those barriers so that they get the services that they need. When a child has, and you know, the numbers are really high for kids in care in terms of mental health diagnoses, medications, and those sorts of things. With that is going to come behavioral challenges. And we have to move from teaching parents how to be trauma informed and into being trauma responsive. So those families need the support of agencies like ours so that they can maintain permanency and don't put the children back in the system because they can't handle behaviors, or they're not effectively parenting because they don't understand where those behaviors are really the root of those behaviors. So that was a really long answer, but the bottom line is access to the families sooner to get them the services that they need so that they can be successful and thrive.
I kind of want to piggyback on what Jenny is talking about a little bit with the funding associated with Bexar County. I think we have big city issues in Comal County, but we have rural resources. So we're primarily viewed as, thank you, Trendy, I knew you would like that. We're viewed as this small town with no problems. And then there are a lot of issues in Comal County that don't get addressed because of that. And we really only have one major funder. Thank you, McKenna, for being here and being on. We know that we can count on McKenna, but other than that, I mean, if we go to San Antonio, we're told, well, how many kids are from Bexar County? Or what are you doing for Bexar County? Or if we go to Austin, it's like, well, what are you doing here in Travis County? And so we're kind of sandwiched in between these huge metropolises, but we don't get the resources, even though we still have the same issues that go on here.
I'm going to jump in. Jacob, first of all, I'm probably going to steal that language of, you know, big city issues, but rural resources. That's such a good way to put that. And I appreciate just the context you guys are giving us about, like, even just some of the differences between y'all's regions, right? Like, you guys are, it's a weird donut that's done in Region 8, right? You got like Bexar, and then the counties surrounding, and just like what those differences look like. I kind of want to just take a second here, because Jenny, you brought up something that I feel like we've been hearing a lot, and that's about, you know, the mental health piece and just kind of how we rely on CPS a little bit, probably as like the default behavioral health system, right? Like, we could potentially be, you know, it could be that, you know, services could actually effectively serve families in the community, instead of kids ending up, you know, on the doorstep of CPS and CPS getting involved. And so, you know, I don't know, I just would love for somebody, whether that's you, Jenny, or not, like, what is still, like, how do we fix that? What do we do? What, does anybody have some solutions as to, I mean, other than just kind of globally saying, oh yeah, we need to have better, you know, mental and behavioral health supports. Is there something specific that anybody can speak to?
So I'll speak to it. You just opened Pandora's box.
Okay.
You know, we have an archaic child welfare system. And if we're going to have different outcomes, we have to start asking different questions. I keep repeating that phrase. I'm going to say it till someone, like, you know, punches me, because we have to ask different questions. If we're going to transform the system, we have to think differently. Annie Casey Foundation has championed us moving from a child welfare system to a child and family well-being system. And there has to be a holistic view on, and I don't like the word holistic, but it's sincere right now on addressing these issues. These are family issues. They're not just child issues. And our system in Texas is really designed on the safety and placement of children. It is a system of last resort, and it is almost exclusively focused on safety and placement. And that is absolutely necessary, but that is insufficient. So there's got to be a family systems approach in dealing with these issues. And if you want to talk about prevention, I mean, first of all, the numbers, 5% of the budget is towards PEI, like that is woefully inadequate. So we're not getting upstream to solve the problems that then are much costlier downstream, right? So if we had a family systems approach in dealing on the prevention side, I think we would see different outcomes. But from what I have seen in my own family and as a foster parent, when a family has services, they're checking boxes. Like if you have to attend an anger management class, or you've got to, attend a financial literacy class, like that is not holistically addressing a family's needs. It's not enough.
I was going to save this question for later, but you've already opened up the like, how do we kind of think bigger conversation? So I say pounce on something you just said that sounds much more negative, but I want to focus on something you said about, if we actually had a different approach, then we could see different outcomes. Obviously, y'all heard me talk about, we focused a lot on data this last session. I'm wondering, Jenny, if this is you or anybody else on the panel could talk to us about what should we be measuring? Like, Jenny, you're talking about to get different outcomes. Our system right now, we track a lot of input and output, but not a lot of outcome measures. Does anybody on the panel have some thoughts about, okay, so if we shifted the system to kind of to look more like when Jenny's talking about, what would we be measuring to know we're successful? Do you have some thoughts? Just because you opened the box there, I want to go ahead and ask that question.
Well, I'll let somebody else answer. I have lots of thoughts about that.
My initial thought is how many kids are with their families. That to me is going to demonstrate success. Why are so many kids in foster care? I firmly believe they should be with their families. The system's not helping them. It's like Jenny said, it's archaic. And so, that to me would be the first indicator, is how many kids are we keeping with families versus how many kids are in facility. They shouldn't be at connections. I'll be the first to say that they should be with their family. So that would be that's my initial thought.
So I like to throw something in too. We sort of see it from a perspective where we watch statewide intakes come in. So we will see a family come in for the first time, and we can pretty much predict there will probably be nothing or little done on the first report, because it's usually a smaller level case. It's like what you guys are talking about with neglect and decriminalizing it. And, but then we know we're going to see that same family again, and we're probably going to see that same family a third and fourth time. So in terms of data and what would be helpful, I've never just sat down and been like, okay, I'm calculating the total number of repeat touches that one family has with the system. Just so this is just my gut, like looking at these reports. And our approach is kind of like, how do we get that family with that first neglect report and get them involved with services and get them the help that they need before we see that second and third and fourth report. And I will say, by the fourth report, I really do believe they should probably be at connections. I'm just going to say, I don't want them to be in that house anymore. But if we could get in that time frame earlier, I feel like that would be essential. But how do we do that? How do we get the numbers for that? That's really the question.
So I'll add in and on that and really kind of talk about the new way. And I do think that community-based care gives the chance for these things that we're talking about to happen. It is not going to happen overnight, but much of the work that you guys are mentioning as a need is something we've all known for a long time. And now our community, Comal County and 26 other rural counties in Texas, have the opportunity to be the change agent, to take all of these things and put them into practice. It is going to be a challenge, a big challenge to move the needle and move the thought processes that the state currently has to where we need to go. But I do think that community-based care allows for that. And so we have set up our model for community-based care while per our contract, stage 1 is focusing on placement. I am in 100% agreement with Jenny that should not be where the focus is. Right now it is. But Senate Bill 1896 allowed for the community-based care office to be moved out from underneath DFPS. They've appointed a brand new director of community-based care, governor appointed community-based care director. They're administratively attached to DFPS, but they're in their office alone. And they're really looking at how community-based care is structured now, how it's going to be structured in the future, and being the first SSCC online under this new way of doing things, we have real opportunity to take what has not worked in the past and where we know it needs to go in the future and applying that out, not only for our region, but as community-based care expands throughout the state. And so these conversations are critically important to get it right. I think now, and starting at the beginning with the legislative changes, while there's still work to be done, we've seen more this legislative session in support of child welfare in the state than we've ever seen before, as far as dollars and funding and capacity building and all of that. But if we don't take all of these issues that we're talking about now and show positive change, they're not going to believe in us doing this work. Again, in the future, they're going to say, we gave you an opportunity and you didn't do it. So now is the opportunity. And so it's really, while it is a huge mountain to climb, it is an opportunity for these conversations to not just stop after today, to continue to pull the communities in more and more. Not one agency can do this alone. We need every single person to be working with us and for us to move this needle forward. So I think that there's hope, but I think that there is so much work to still be done.
Tara, just a clarifying question. Family-based services don't move to the community-based care model until stage 3 or 4?
Stage 2, there's a part of case management, and then going into stage 3, which there's not even a community-based care organization that's in stage 3 yet.
Yeah, that's what I thought. So you're correct. We've got to demonstrate positive outcomes now, but we're a ways off before we can that prevention side is even going to be localized, which is a barrier to some of the work. I have 3 things. That was one of them. The second thing is, Carrie, how do we fix this? What are some of those obstacles? I mean, Medicaid is not a way to help build capacity for any services. That's why we have to rely so much on the philanthropic community like McKenna and others, because you can't add new capacity to further your services or your reach by relying on Medicaid. And to be completely honest with you, some of the contracts with the state, they're prohibitive, obviously, in just paying for the people to do the services. But also some of the licensure requirements are so archaic, where there's flexibility with community-based care when you've demonstrated positive outcomes. So that's a positive in terms of working with Belong, for example, versus the state, but we don't have that opportunity on the PEI side to the same extent currently. And the third thing is going back to the outcomes. There's been so much focus on CWAP, unfortunately, and it is 0.5% of the kids that are in care that are requiring so much attention. But one of the things that we see is a high percentage of the kids that are coming into care were previously adopted through the state. So we have asked the department for that data because there is a story to be told about that, because those families are not getting the appropriate services that they need early enough to prevent another breakdown in that child's life. So as an example, like we measure 9 clinical markers of trauma-related behaviors when we start working with a family and the child, and we measure parent stress levels as well clinically. So we can see all of those numbers in our work, working with families. We can see all of those numbers: aggression, depression, anxiety, PTSD symptoms, parental stress levels decrease with appropriate care in the home. And then we see those families progress. We're able to stabilize them through crisis, and it leads to permanency. Well, if you look at our data that we track, there's not even anything to measure. Like, there's nothing to compare it to, because we're not measuring children's well-being. We are measuring whether or not they're in, how many placements they're in, how quickly was the case closed. We're not measuring well-being systemically. That is a major problem. So I mean, in a perfect world, when these kids that are adopted out of foster care, if we measured those things at that time, we would know what kind of services that they may need, so that they can avoid crisis in the future. We also know that trauma is developmental, and that it hits at a child's developmental, at different developmental ages of a child, 11, 15, 5, like there's these. So if we could actually be proactive in reaching out to families who have children in those developmental milestones and say, here are some additional services if you are having any current struggles. However, we can't do that because of confidentiality issues with the state. So we don't have access to even market those services or reach out to those families, even the ones who adopted through the state. We can't do that proactively. So that's another prohibitive factor in actually changing the well-being outcomes that we need to measure, because we don't have access to do that.
That's fascinating. Sorry, I think because I could hear a little bit of in what you were saying too, like not just like with trauma, so working with families, where kids have been, removed in their, in the state's custody, and then potentially, have reached permanency in a different way. But I mean, I feel like that's even kind of touching in the prevention space too, of saying like there's certain times we know we should be maybe not intervening with families, but offering supports to kind of help divert away from the path of going towards the CPS door, essentially. So that's a really good point. And, we've touched on CBC, and we've touched on capacity. I would like us to kind of stick with some capacity conversation if we can. So y'all heard me whenever I was kind of laying out some of the stuff of like, there's a lot we don't know. Like, we don't really know how many kids specifically in y'all's area, what the specific, like we know kind of some general specifics here. I'm curious, first of all, what's being done in y'all's area to kind of expand capacity, but also like, what are we seeing? Like, I mean, like I said, I know we know about like the, Jenny, you talked about like a lot of kids that are kind of coming back into care, whether it's that wrapper situation, or just in general, not getting the services they need in the community and coming back, and don't have a placement. So can anybody expand on like, what are we seeing with the placement capacity that's very specific to y'all's area?
I can speak to that, and then I can turn it over to Jacob, because I think that's actually his topic. But one of the things that I can tell you is that we do not have, so I think that even speaking about capacity, there is a difference of opinion based on who you're talking to, what capacity actually means. So for me, and what I'm about to say, I'll say that the capacity that I'm talking about is what I need the most right now, which is actual bed space, safe, licensed capacity bed space for kids that don't have placement. That is kind of the number one issue from my piece of child welfare right now that we're working towards. And I think that there is merit and value in other pieces of what capacity means. But for the way that I'm going to answer it is that piece. So we need in Comal County and across the state, frankly, we need step down capacity that's when kids are released from psychiatric hospitals, we need step down services so that they can have what happens with them in the psychiatric hospital can carry out. Many times our kids that end up in CWAP or children without placement are coming from a psychiatric hospital and they don't have any place to go. So we need either bed space in a QRTP type, a crisis stabilization center type home, or we need I think we need all the pieces. There's not one answer. So we're looking at the ways that we can develop that in our county through some of the capacity building funds that were mentioned at the beginning of this. We also need therapeutic foster homes that are licensed homes in the community for therapeutic care that will take that one child that is stepped down, that does not need to be in a psychiatric hospital anymore, but they need a solid placement. So we need that as well. We also need, as far as bed space and capacity, we need respite and emergency care for kids, so that when there's an immediate removal, I do believe with what Carrie said at the beginning with the definition of neglect, that's going to change some of the emergency removal. And I've always been saying, if we assume that they're in a safe home, that's great. But I fear that what if they're not in a safe home? So we have already seen the numbers trend down a little bit on emergency, but that still doesn't help midnight tonight when there's not a place for a kid. Where are they going to go? So we have to build out the emergency placement piece of things, short-term emergency placement as well. But really focusing on safe, stable capacity for these kids, because we don't want them in unsafe placements. We don't want them in unlicensed placements. And so what does that look like? And so that is really going to take the community working together to build that specific bed space capacity. And then I'll let others talk about anything different there, because I do think that there's some differences. So Jacob, if you want to speak to your foster care capacity.
No, I know what we're seeing kids staying at our shelter longer. So a few years ago, you would see kids come to a children's shelter. They would come in and out, maybe 14, 21 days, very quick turnaround. Now we're seeing kids essentially staying at our shelter all school year, or because there's nowhere for them to go. And so we have a young lady right now who was in our Corpus shelter. She was there 7 months, and now she's been in New Braunfels for about 5 months. So it's just, she's basically growing up with us because there's really nowhere else for her to go. And so I'm seeing a lot of that. I'm seeing kids stay at the shelter a lot longer than ever before because there's just simply nowhere for them to go. I think I looked up some numbers before the meeting. We had about 169 youth in office last month. That number was around 450 or so during the summer. So that's getting better, but those kids are staying in the offices longer. They're staying on average 18 days. So it's pretty concerning to me that there's just nowhere for these kids to go. I think some solutions, I liked what Jenny had talked about. Minimum standards is ridiculous. Like the rules that foster parents particularly have to follow. I think from a GRO standpoint, we got it down. Like for most providers who are quality providers, they can do it. It's manageable, but I've been a foster parent twice. Both times it was ridiculous to have to do some of the rules that I had to follow. For example, I had to change the locks on my garage for my 17-year-old at the time because he couldn't have access to gasoline. And it's just like little things like that. It drives foster parents crazy when you have childcare licensing come to your home. I had them come to my house once and stay from 6 p.m. to 11 p.m. while I'm trying to get my kids to sleep. And there's no concern for how that affects a foster parent necessarily and the children. Everything's so abnormal. Like that's not normal. So it's just providers, we kind of get used to it. But the little things and minimum standards, you have, I think it's a 330 page plus book of rules to follow. That's crazy to me. Like that needs to really be reduced to common sense, practical things that can help keep kids safe, but also just common sense stuff of it doesn't have to be as overwhelming as it is. And I think those are some of my ideas. Oh, and also I liked what Brittany had said about the House Bill 3041 about doing some more of those pilot projects with FBSS and some of these upfront interventions. We have to invest more and we have to phrase it as an investment. There should be 95% of the state's budget should be PEI and 5% should be foster care. So it needs to get flipped if you want to keep, if you want to help with the capacity crisis. So all the above, I like what Tara said, it's going to be multifaceted. It's not going to be just one thing. It's going to take a lot.
I'll jump in here. I completely agree with Jacob on the how ridiculous the requirements are for foster families. We have a staff member who's a foster parent, and her agency got deemed because she had a spice cinnamon that was outdated in her cabinet. I mean, that's the environment we're living in. Like, so, but we got to stop the nonsense if we really want people to open their homes to kids. But I want to go back to something that was talked about earlier. I understand why the legislature changed the definition of neglect. I have some concerns about that. But I'm also, Jacob mentioned how the numbers of kids have declined and that we're seeing less kids come into care. My fear is that it's not just because of this definition of neglect. We have several subcontracts throughout the state with post-adopt providers, and we are hearing that CPS will not pick up the kids. So there are people who are calling themselves in to CPS to say, I can't handle these behaviors. I can't handle this child. I need your help. And they're saying we won't pick up the kid because they know there's nowhere for them to go. So it really is like, even though the numbers may look better, what we're hearing on the ground from workers does not sound better. In fact, it sounds more alarming.
It's interesting because I feel like, we've heard a lot of things, like, do we look at, is it the concurrent stage issue? Is it the neglect definition? Is it the removal of non-emergency removals? There's so many things to look at there, but I appreciate you sharing what y'all are seeing on the ground, because I do think we're seeing different things across the state, right? Like, because a big issue with this is it's not only implementation and interpretation on the department, it's also on judges, and obviously everything that's going to be, that's jurisdictions, like everybody's going to look at those things kind of differently. But that's interesting about CPS not picking up because they know they don't have somewhere to go. Interesting. Okay. I was looking at the time here, so just want to make sure, because we've got about 8 minutes left, and here in 3 minutes we need to kind of just do a little bit of a wrap up. First of all, you guys, again, I wish each of our tours we could just take a whole day, because you guys are sharing such great information. I want to pivot. This isn't something necessarily, you guys have kind of piggybacked off of each other and brought up different questions, but something I do want to ask is, for us at TexProtects, when we are thinking through policies, I'm just curious if any of y'all have some thoughts about, basically like how to incorporate voices of those with lived experience, whether we're talking on, the prevention front, where, you're working with families, or, youth and care. Does anybody have some recommendations or some examples of how y'all done that well, and how we could potentially kind of mirror that? I don't know. Trendy, do you have some thoughts on that?
So in terms of have we done it well and would you like to mirror it? I will say, no, not yet. Being completely honest, but I can tell you we have a great opportunity coming up. We just got extra funding from HHSC through the CAC of Texas to expand our counseling services. And it's exactly what you've been talking about today, which is, typically the CAC world, we live in the tertiary world of prevention. Everything's already happened when we get introduced to forensic interviews and all that. And then we introduce primary stuff by doing darkness to light presentations and community awareness. But what we were missing was how can we get in there when there is a problem, it's been noticed, and there is risk, and how can we make a difference? Like what I was talking about before, between that first report and that fourth report, that's really a critical time. So with the funding that we just got awarded, we're going to expand our counseling services so that we can reach out after we get a statewide intake on a family, hopefully the first time, and offer services, offer all of the people here who have resources to offer families, suggest them, do some case management and do some trauma-informed counseling. I'm hoping that will make a difference, but I can't say, oh yeah, we've done that and please mirror that. So, but that's my idea for now. And I will come back to y'all and tell you kind of our outcomes, hopefully great ones in the next year or two.
And kind of what I'm getting at is kind of like also like from like an equity, kind of like what kind of things do we need to be keeping in mind? And Jenny, I saw you came unmuted, so I don't know if you were going to share something on that.
Yes, not as much on the equity side of things. It's very important, obviously, to hear the youth's voice and have their input on programming and what's effective. We do have a large percentage of our direct care staff has lived experience. They're foster parents, adoptive parents themselves, or they've been in kinship situations. I mean, I can't overstate how valuable that is. It is incredibly valuable because you're working with somebody who understands the challenges and what you've been through. As far as policy goes, I do work quite a bit on trying to move the needle on policy reform, and we work with our partners to incorporate the voice of the parent that we're working with so that their voices are being heard at the legislature, because the legislature is making decisions on their behalf and from Austin and not in the home and seeing how that impacts them. And so we have found incorporating their voices into those policy efforts is incredibly important.
Thank you. All right, I'm going to go ahead and kind of pivot us to to close. First of all, thank you so much. You guys are amazing. Everybody on the panel, you guys really offered some really great information. And I really do look forward, to working with you guys a lot more moving forward. I feel like I've said this over a lot over the last few days about how we can't do our work well without folks like you, and without hearing from you guys what you guys are seeing on the ground, and obviously all the wonderful work y'all are doing. And so I look forward to the continued partnership, and just thank you so much again for taking time out of y'all's day to share with us what you guys are seeing and so much of your expertise. You guys are truly phenomenal. So just like I said, we're going to kind of pivot to a close here. So not only thank you to the panel, thank you all for to everybody that just signed in today and participated in the chat. And this is not the only opportunity that we're going to have to talk with you guys. Part of our slideshow at the end also has Brittany and my information. Again, please know that we want to continue these conversations. This is not a one and done, and you'll never see us again. We want to continue these conversations. And so, how can we kind of continue the work together? How can you guys know what the heck we're up to over here at TexProtects? Just want to let you guys know on our website, one of the easiest ways to kind of know what we're up to and join us in our work is to sign up for our action alerts. And so, this is something pretty easy. You go in on our website, you put in your email address and things like that. And even during session, it'll send you different things about bills that are moving that you can, act on, but also just different events like this that you can plug into, and different things, again, of how we can kind of link arms. Oh, I went too far. Another thing that you guys may want to check out, and some of you may have already participated in this event, but just for more specific ways and tips and tricks for how to get involved in, like how do you share different things on social media, or like how can I talk to my legislator, like what's important to know. We have a webinar that's literally called Be a Champion for Texas Children. It lives on our website. Please go check that out. We have a lot of information there, and actually we even kind of got some insight from some staffers just to kind of give some ideas of what they're looking for too if you want to get involved in the legislative process. Also, we have resources here. You saw one thing that's very specific to y'all's area. Brittany had kind of gone through that home visiting profile. We have that linked on here, the Comal County, but also some of our briefs that we've done on some of the topics we've talked about today. Some of you may be familiar with our State of the State. That's basically where we've taken some DFPS data, broken it down, and kind of painting a picture of what's going on in child protection in Texas, and also some toolkits on here. So click through there. These are all super helpful, and hopefully a great resource for you all. And then last but not least, thank you again. Gosh, Tara, Jackie, thank y'all so much. We always enjoy partnering with SJRC. So thank y'all so much for this partnership. Thank you again to our sponsors, the Texas Child Welfare Funders and Casey Family. You guys are great. And thank you so much again to our panel. You guys are wonderful. And thank you all to all of you who jumped on today and spent the last hour and a half with us. And then last but not least, here's our contact information. Again, you'll get these slides and you'll know how to reach us. But this is our policy team. And again, we would love to continue conversations. So it is 11:30. We're going to go ahead and end the event now, but I hope you guys have a great rest of the week and enjoy this cooler weather.